All right, so this is take 2 on the vital signs test out video for you guys. So I'm gonna walk you through how we expect the test out to go. So when you come in, this will be all set up for you. You'll have your hand sanitizer, the thermometer, alcohol swabs, the pulse ox. You'll have a blank note card. You can write, once the test out starts, you can write whatever you'd like on here. So if you want to write temp with your temp conversion, pulse with the grade, respiratory rate, palpating the systolic, what the blood pressure was, your pulse ox, and pain. So once you start, you can write whatever you like on here, and we'll also give you a basic calculator. So Mary is going to be our student. So she's going to come in, she'll do her introduction, she will wash her hands, and she'll check the patient's name and date of birth. Now again, I'm not so concerned that you grab their armband and check an armband, because in clinic settings and things like that, they won't have one. So I'm okay with you just asking their name and date of birth. Then Mary will take the temperature, and like I said, you can convert it from Fahrenheit to Celsius right away, or you can do it at the end. So I'll let Mary come in and do her thing.
Knock, knock, knock. Hi, my name's Mary. I'm going to be your nurse today. I need to get your vital signs. May I have your name and date of birth?
Katie Lally, 9788.
Okay. All right. I'm going to explain what we're going to do. We're going to take your temperature, probably in your ear, okay, and then we're going to take your blood pressure. And is that okay?
Yep.
All right. And so now I'm going to wash my hands. Okay. Usually you do that before you touch the patient. Okay. Whatever you want to do. All right. Okay. So first we're going to start with your temperature. Have you had any ear pain?
No.
Okay.
And again,
It's kind of wet.
you may get a different thermometer, so again, make sure you know how to use all the thermometers. You know how to turn them on. And then also, when you do take a tympanic temperature, make sure that you're pulling a little bit on their ear and that their hair is out of the way. So Mary will demonstrate that.
Okay, so we're going to pull up on this part of the ear. Make sure it's on. And then I'm going to make sure this goes down in and then push that. When it beeps. Okay, I would tell my instructor what the temperature is.
Okay.
And I'm going to write it down for myself, 99.5. And then I would convert it later.
Okay.
Okay, and then I would clean this off.
Yep, and there's a garbage can over there.
Can.
All right,
And
excellent.
remove this. Okay, the next thing we're going to do is we're going to take the pulse.
Okay.
I'm going to be on one side and my instructor's going to be on the other.
Okay.
Okay, and we're going to count for 30 seconds times 2 and then go from there.
Yep. And again, remember to use a clock in the lab and let your instructor know when you're going to be starting. Please don't use your personal watch. Once you find it, this one's good. If you need to switch arms, that is totally fine.
I got it. Okay, so we'll start at the 12.
Okay.
Oh, I lost it.
Okay.
So if you do that, you can start again.
All right. Let me know.
Okay, start now.
So in that we did the pulse for 30 seconds and then we went straight into the respiratory rate. So Mary then will tell me what she got for the pulse,
Okay, I got 78,
and I got 80, and then she'd tell me the grade.
2 plus.
Oh, and I won't prompt you for the grade, so
Okay.
you'll just have to tell me the grade. And then for the respiratory rate,
I got 16.
and I got 16. Okay.
Okay, so now we're going to do blood pressure.
So with that, remember we're going to palpate the systolic first. So what Mary's going to do is she's going to find the brachial pulse. She'll put the cuff on.
Okay, you can have a table over here if you want to put their arm on a pillow, or you can put a pillow in their lap, just to give them something to rest on. Okay, I'm going to find her brachial. Okay, I know where that is, so I'm going to line up my cuff with the brachial artery. Make sure it's an inch or two above the crease in the arm. Okay, and the cuff should be on fairly straight. And there should be, you could only get 1 or 2 fingers in here. It shouldn't be dangling where it falls down their arm. Okay? Now, I'm going to find the brachial again. Sorry, come over there so you can see. Okay, I'm going to find it till I feel it really well. And now I'm going to pump this up till it goes away. Sometimes you have to stop a minute and see if you feel it again. And now I'm going to let it out slowly until I feel it again. Okay, about 112. So I'm going to go ahead and let it all the way out. Okay, now I'm going to do a regular blood pressure. Nicole.
Alright, so this is where your instructor will then get up and join you. We're going to be using the dual stethoscopes for the blood pressure, so make sure you at least practice that a few times in lab so you know what that sounds like. Probably should have detangled these before the video, but
Case wrong.
yeah.
Okay. All right, remember your stethoscope goes in this way. Okay.
And so now she felt the systolic, the pulse come back at 112, so she's going to go 20 to 40 above that. So she's probably going to pump it up to about 140.
Oops. Okay.
Thank you.
All right. Okay. And the next thing we're going to do is the pulse ox. I'm going to see what her oxygen saturation is.
Don't
Okay,
mind
you're going to
that.
put it on the finger like this and turn it on.
And for the pulse ox, we want the first number, which is the SpO2.
You're not going to take the pulse off of the pulse ox.
Mm-hmm.
Okay, so we want this number right here. Okay, so 98. Take that off. And one last thing. How is your pain level? Are you having any pain right now?
No pain.
Okay, so it would be a 0. Okay, so that's it. And then,
So then at the end, you would give a verbal report to your instructor. So you would go through and tell us what the temp was in Fahrenheit, what you converted it into Celsius. You would tell us the pulse and what you'd grade it at. You'd then tell me the respiratory rate, what you palpated the systolic for, what you got for a blood pressure, what the O2 saturation was, and then the pain. And that would complete it. And remember, for the vital sign test out, I won't be prompting you. None of your instructors will be getting up and prompting and asking. So I know for the sake of this video, I did a lot more talking, but we'll kind of be sitting we'll get up when you're ready to do the pulse and respiratory rate, and then we'll get up again after you've palpated the systolic for the blood pressure. Other than that, you'll get a chance to practice in lab this week. Thanks.